Okay, it's 8:33 and I think we should get going. Welcome everyone. I am Rebecca Batensky. I'm the chair of the Biostatistics Department at NYU School of Global Public Health. And I'm really happy to welcome you tonight to our event, our session on biostatistics and data science in the age of COVID-19. So I'm really pleased to have with me several of the faculty in the biostatistics department and staff and a former student and one of our communications support as staff as well, who put this all together. And you'll get to meet all of them in the course of our program. So the plan is the following. So I will start and give you a very brief introduction to the department. Then I will say a little bit about what we've done in response to COVID-19 as a department in terms of our educational programs. And then we'll have a few of our faculty and former student speak about work that they've done as biostatisticians working on COVID-19 related projects. And then we'll hear from other faculty just about their work in general. And then we will address some of the questions that have come into us from you in your responses. And then we will open it up to just any questions that you might have. So as you can imagine, there's a lot to cover. We won't cover it all tonight, but hopefully we'll give you a good introduction and pique your interest in biostatistics, pique your interests in NYU, School of Global Public Health, and hopefully you'll come back and talk to us some more and come to us with more questions. So you don't have to view tonight as the end. This is just the beginning. Okay, so I wanted to start, I'm going to share my screen by taking you to our web page very quickly. So let me share my screen, and there we go. Okay, great. Okay, so how can you find us? You can find us just by Googling NYU Global Public Health or School of Global Public Health, and you'll be taken to our website, and here it is. And then if you want to go directly to our department, you can go to About and go to Departments and Programs. And biostatistics is first, although it shouldn't be alphabetically, but we won't tell anybody. So there's oops, what did I just do? There's biostatistics. And you can see that we have quite a lot of content here on our webpage, which is really wonderful. We work hard to keep it up to date with the support of our staff, Vardia and Evan. And so I encourage you all to spend a lot of time exploring, and you can learn about who we are. I'll just take you here quickly. So here are our 7 faculty members, and you'll meet 5 of us tonight, and our 2 staff members who are extremely important in all of our programs. And you can read about our work, you can read about our publications, and you can go into all of these tabs and just learn about all of the many, many things that we have. I won't go through them tonight, we don't have time, but there's a lot here that you can explore, and we encourage you to explore. So I just wanted to begin with that overview. And then as far as the department goes, in terms of degree programs, we have 2 master's degree programs. We have an MPH with a concentration in biostatistics, and we also have an MS in biostatistics. Both of them are 2-year degrees. Both of them require a thesis, which is done in the 2nd year. And there are some differences between them, and you can read on the web page. I won't try to find it right now, but it's not hard to find, about differences and comparisons between those 2 degree programs. Additionally, we just opened a new PhD concentration in biostatistics, which is starting this fall. We're very excited about that. We have 2 incoming PhD students. This is part of a general PhD in public health with concentration in biostatistics. So it's a PhD, it's not a DRPH, which is what some schools of public health have. So that's brand new, and like I said, we're very excited to begin that. With that, I think I'll leave that as far as the introduction goes. So again, you know how to find us now, and please explore. So now what I wanted to do was to turn to our topic for tonight. So let me stop sharing that and open up a new screen. Okay, here we go. Okay, let me, okay, I think that's good. I wanted to tell you about what we're doing. So why are we talking about COVID-19 when we want to be talking also about biostatistics? Well, it's of course very timely. It's affected all of our lives in very, very serious ways. And it also is something that we are poised to respond to professionally as biostatisticians or as public health researchers. And so it's actually a very interesting and nice example to show you how biostatisticians and how biostatistics can operate in the world, in the everyday world, and in the world of public health. And so that's why we decided to organize tonight around the topic of COVID-19. It's what we're all dealing with in every aspect of our lives. And so one way that our department has responded is through courses that we quickly put together for the summer. And I just wanted to show these to you and tell you about them, because I feel like they're very exciting and very timely. And I think it's really a nice offering that we have. So we have here 5 courses, and they're all related somehow to COVID-19, some more so, some less so directly. But I wanted to just point them out to you. So the first is a course on data science and machine learning in public health, practice and research. Of course, that's a very general course about general data science and machine learning. It's very applicable to many things. So that's one of our 1-credit courses. So I should mention these are all 1-credit courses. They meet for about 10 hours. And students, our current students can take these courses and use them to put together elective credits that they need. We also have people taking them who are not even students at NYU. We have some undergraduates taking them. So we have a whole variety of interest from different places. The second course here is a course that I'm teaching on clinical trials. So that's a research interest of mine. It's something that I've been working on and publishing on and been involved in for many, many years. And so I like teaching about clinical trials. And so I focused this particular course on the topic of COVID-19. So as it turns out, even 2 months into this pandemic, there were something like 800 clinical trials going on about COVID-19, seeing, in a desperate search to try to find some kind of effective therapies. And so I'm teaching this course using COVID-19 as an example. We're looking at publications on COVID-19 trials. We're looking at protocols from these trials. And it's all, all around general concepts of clinical trials. My colleague Yang Feng, whom you'll hear from later tonight, is teaching a course on social network data analysis with application to COVID-19. We have another course that several of us, so my colleagues Yang Feng, Melody Goodman, and then colleagues from epidemiology, Aris Hatna and Danielle Ompad. So we're co-teaching a course called Statistical and Epidemiological Evaluation of COVID-19 Studies. And we're dealing with different topics within that, looking at epidemiological modeling, looking at problems in underreporting of testing or under-testing, problems of bias, and underserved populations. So that's what this course is about. And then this last course is a more general course, providing SAS and sort of an intensive SAS boot camp for students with some application again to COVID-19 data. So again, this is just an example of our response from our educational, for our training that we've put together very quickly and we're very excited about. Okay, so now I want to turn to Denis Kunichov. So Denis is a former student in our department. He graduated a year ago, and he's now working as a master's biostatistician at NYU Langone in the Department of Population Health. And I know that he's been involved in COVID-19 related work, so I asked him to come as a former student of ours and to describe the kind of work that he's doing and projects that he's worked on. So please go ahead, Denis.
Hi, hi, Dr. Batinsky. Hi, everybody. It's great to be here speaking alongside some former professors and mentors. So I'm excited to tell you a little bit about my work. I prepared a couple of slides. So I'm going to just figure out how to share my screen now. So firstly, I'll just talk a little bit about, I think, what Langone, NYU Langone is doing as a whole. You'll find basically all the research, given that it's a hospital, is around different clinical and medical and biomedical features and characteristics of the disease. And the two major categories of research coming out are clinical trials and observational studies. Clinical trials are often testing different protocols and practices, different treatment drugs, vaccines. And if you look on the public database, you'll find approximately 14 different active clinical trials. A lot of this is just very introductory. And then there's observational studies, which is using electronic health records to look at the different health outcome and medical data of current patients and former patients, and using all of that data and then doing analysis on it to find just different patterns and relationships and associations relevant to treating the disease and managing and preventing. All the work that I'm doing is observational studies. There are statistical teams on both, obviously. And personally, I think the observational studies are a little more interesting, and you get to be a little more flexible with statistical methods and using different advanced statistical methods. So I've so far been on 5 analyses, and of those 5, one of them has been published. The others are in a variety of phases. So some have just been submitted. One has been resubmitted after getting comments, and the others are still in the analysis phase. The one that's been published is cited right here. And of all these projects, there's basically 3 major categories. And again, this is just all related to clinical outcomes and medical events related to COVID. So not looking at kind of more broadly public health or social science features. So I'll just quickly go through these. There's medication risk analyses, where I've been comparing differences in outcomes based on previous prescriptions and looking at, for example, heart medications and seeing if people being on heart medications contributes to increased likelihood of having a positive COVID test, or increased likelihood of developing severe COVID symptoms. And so, yeah, I'm on 2 different studies that are looking at the risks of being on medications previously. And like I said earlier, this one right here is the one that's been published. We got the chance to do some pretty interesting analyses with those studies too. Bayesian analysis specifically, which is just a more advanced kind of analytical method that also allows you to frame the results in different conclusive ways based around likelihood of the events actually happening. And the other kinds of studies, the medication benefit analysis, that's been a time to event analysis to see if certain medications allow for longer time to death or no death at all, or longer time to, or shorter time out of ICU. And then kind of more, or very traditionally, we're looking at just different associations between clinical biomarkers and clinical events and disease outcomes. So it's a couple really popular, I guess you could say, biomarkers in the current COVID-19 research realm is D-dimer, which is related to anticoagulation in the blood, or C-reactive protein, which is related to the inflammation and immune response. And yeah, it's been really great to be part of these studies, and a lot of them have been very rapid response, and so it's quite an interesting workload too. And in addition to that, there's all sorts of challenges with kind of taking these traditional statistical methods and then applying them to this new setting. One thing that is something that became really important that we realized later in some of these analyses was controlling, for example, the time at which patients were admitted, because the practice in treating patients with COVID changed so rapidly over the 4 months that it was really bad. And so it's these kind of small things that are like offering unique challenges to designing models and developing the statistics for this. So that was a short introduction to the kind of work I'm doing. Thanks again for having me here. Oh, I think you're muted. Yes, you're muted.
Sorry about that. Thank you. Yeah. So thank you, Dennis, and we'll have questions for you for when we move into our discussion portion. So thank you. Okay, great. So next, Professor Yang Feng will talk about his work.
Okay. Hi everyone. So first, I'd like to thank Dr. Batinsky for the introduction. So today I'm going to give a short review on the overview on what my research has been done on related to COVID-19 works. So I just want to so the first piece of research I did was like a little bit of data exploration. It was done back in March, where in a lot of the states in the US, there was this social distancing advocates, and also this stay-at-home orders. So at that time, I did a very simple analysis for the so-called doubling time, which means how long it takes for the confirmed cases to double. So as you can see from this plot, so this is the date in March, back in March this year, and then the y-axis is the COVID cases in thousands, and you can see there is a clear change occurring near the time of March 23rd, and this is you can see I fit two separate linear lines. So this is done by simple linear regression. For two piecewise, it's a piecewise linear regression done before March 23rd and after March 23rd. So you can see that before that, the COVID cases is doubling every 2.3 days, and after that is doubling every 3.8 days, which shows that at least at around that time, the social distancing and the stay-at-home orders is making a significant effect in suppressing the spread of the disease. Of course, now, I guess recently is another story that maybe the social distancing orders is not like respected, and also the stay-at-home orders are lifted, so that we see the surge of cases recently. So this it was a opinion article in NY Daily News back in April. So lately I've been started work on projects sponsored by supported by NSF, which is on the behavioral epidemic modeling for COVID-19 containment. So basically, there are the main idea is to study the following two things, which is first of all is the impact of premature lifting of social distancing guidelines, which is I guess is very relevant right now in many states. And another point is the abandonment of social distancing by a large percentage of the population. So you can see people go to bars, go to beach. Especially in the summer, people have been staying at home for a long time. Maybe they just want to get out. So we want to evaluate like how those behaviors will impact the epidemic. And in particular, we will introduce new models that take into account of the data from social media platforms such as Twitter and Facebook. And because of that, we'll also use machine learning approaches to determine, say, what is the optimal intervention over a wide range of scenarios and control strategies, because there are a lot of different issues regarding the epidemic and also the social impact, economic impact. So a lot of different factors can determine like what should we do, and maybe it will also depend different states, different counties may need different policies and behaviors, right? So so I just want to show you some recent visualization results we got from, so you can see here I just picked 4 states, maybe it's the states. So the first 3 states is California, Texas, and Florida, which are the 3 hot states right now in the rising COVID cases. So you can see that the red curve is the case count, and this is taking a logarithm transformation with base 10. So you can see that, for example, in California, you see a surge of cases after June. So you can see that it never enters a decreasing pattern actually. Which is the same for Texas and Florida. So you can see that apparently the Florida and Texas is in a worse shape than California, because the slope, you can see it's higher for the cases. So you can see New York, although it has a very steep rising at the beginning, I think after April, you can see it's like a steady decline up until now. So this shows there's a significant difference across this 4 states. And you can see that here I'm including 3 important measures. One is this is the Twitter counts for flattening the curve, and also the social distancing. So you can see the dynamics across different states, and also there is the social mobility index within each state. So, so the idea is to incorporate those factors into epidemic models, and hopefully design some policy and also do some predictions. Hopefully can imply what we should do, and we want to predict ahead what will happen so that we can take a better action. So yeah, that's all I want to talk about. Yeah, thanks.
Great, thank you. Okay, so I am going to share my screen. Okay, so let me do that. Okay, so, okay, great. So this actually follows very nicely from Yang's presentation. So you remember his one of his early slides, he had the picture showing how the doubling time had increased in the analysis that he did, and he published a very nice piece in the New York, what was it, Daily New York
Daily News. Yeah.
Daily News. Okay, good. So I saw that and I thought that was really interesting. But first I had to learn what doubling time was. And then I realized that's great and really interesting, but I couldn't stop myself from worrying, as I always do in all of my research, about bias or selection bias or missing data. Those are topics of my research. And I wondered how much could we really believe those doubling times if we're just testing in a very potentially biased way. So we're not, randomly testing the population, but a very small portion of the population is being tested, and certainly they're not selected at random. And so I worried about, while there are these great sources of data, we can go and we can look at daily counts, how meaningful are they, and how meaningful are the measures that we calculate from them, such as the doubling time? And so, so I got Yang to work with me, and we just started to think about how could we go from what we observe in the websites, whether it's the New York State or the New York City or the CDC or covidtracking.com, how could we go from what we observe there to the truth, which we don't get to observe, and that would be total number of cases in a particular region. And so we sort of mathematically, we formalized it, and we mathematically came up with sort of that mapping. And it still didn't help us nail down what that doubling time really was, but it did give us a framework in which we could conduct sensitivity analysis. And that's what this picture is showing. And I can't explain all the details. I don't have the time to explain all the details, but you can see we took the 12 states at the time. This was from like the first week of April. These were the states that had the highest counts in that first week of April, or maybe the last week of March, something like that. So, so these are the cases. And we did the analysis where we sort of estimated the crude doubling time, and that's kind of the center curve here. And then we did our sensitivity analysis around how much bigger or how much smaller it could potentially be according to how testing has changed, and specifically how it has changed within those who are truly infected. That turns out to be what matters. And here we're just looking backward in time. So day 0 was like April 7th or 8th, and then we looked backward in time, and you can see that the doubling time was increasing, which is a good thing. We want the doubling time to be as long as possible. That means the cases are slowing down. So anyway, this is just a picture. So that paper we actually got accepted. It's in press at the International Journal of Epidemiology. So this is one example of a research project. And again, it's organized, or it was, motivated around my own area of interest. And that's really how we operate as biostatisticians. We sort of have our own areas of expertise and interest, and we bring those to bear on the current important problems in public health, in biomedical science, in whatever application we're working on. And so this is an example of that. Okay, and then I wanted to give one other example, and I think that's here. And so here's an example. So these are power curves. And so this is an example, not of any research, but of very, very practical biostatistics put to use. And so this is a quick consultation that I did, actually for the head of student health at NYU, who was and still is in the process of trying to devise a plan for testing. And this is still not decided, not definite. This is just examples that I showed him, but I wanted to show it to you, just again, to show you an example how a biostatistician plays a role in policy, in in design of surveillance, such as this was. And so here you can see, again, different curves. I hope you can see them. Some of them are light, that have to do with the number of samples that might be tested, meaning the number of people within the NYU community who might be tested on a weekly basis. And this is showing, the power of being able to detect a signal, where a signal means an elevated rate of infection relative to some baseline. And so that's what this picture is showing. So again, just an example. So two examples together of biostatisticians as researchers applying to the real problems, and biostatisticians as collaborators and consultants working on the real problems. Okay. So now I am going to turn to my colleague, Professor Melody Goodman, who will talk about some of her work and examples.
Hello, everyone. Let me share my screen. So, as an overview of some projects that I work on, I'm more of a generalist biostatistician, so my work focuses on health disparities broadly, but I do a lot of collaborative research, as Dr. Brzezinski mentioned. So the first project on here is a project where I am principal investigator on, so I'm the lead researcher, and it was my idea, and I'm interested in developing a survey instrument that assesses how engaged non-academic partners feel when they're engaged in the research process. And that is funded by the Patient-Centered Outcomes Research Institute, who is really interested in engaging patients in the research process and other stakeholders in engagement. So this study is actually ending at the end of the month. We've officially named our survey tool. It's called the Research Engagement Survey Tool, or REST for short. Another project that I'm involved in is a collaboration between the School of Public Health and NYU Langone Medical Center. And it's really a training program for dental fellows who work in vulnerable areas in New York City, serving patients, and we're training them in public health and also developing some additional training modules for them related to the social determinants of oral health. So that they're better able to engage with the patients that they see. I'm also a collaborative biostatistician with another faculty member in the School of Public Health, who is doing a study to examine stigma amongst HIV positive pregnant women in Botswana, and working on an intervention that will reduce stigma among that population. And then another study that I'm working on is in collaboration with researchers at Washington University in St. Louis. I'm working with a bioethicist, so someone who really is interested in the ethics of biomedical research. And we're looking at the informed consent process, particularly for clinical trials that enroll older adults or those that are at risk of Alzheimer's, dementia, or cognitive impairment. Really trying to understand if they are getting enough information to make informed consent about participating in research studies that are designed to help them. And then another project that I'm working on in collaboration with researchers at the University of Utah and NYU Langone is looking at the use of medical records to identify primary care patients who should receive genetic testing for cancer. And then you can identify those patients using an algorithm that we've developed in the medical records. We have an intervention in which they engage with a genetic counseling chatbot that helps them decide if they should get genetic testing, and then if they do, we sort of pull them through a process, and then they get help from a genetic counseling assistant. In addition, I'm working with the National Board of Public Health Examiners, which delivers the Certified Public Health Exam, which is an examination that students who receive a master's in public health can take to get an additional credential credential if they want to be certified in public health. And there's some evidence that there are disparities in exam passing rates. And so I've been working with them to examine the data to look at racial disparities in who passes the CPH exam and how we can work to make sure to reduce that bias. Another project that I'm working on with 2 faculty members in the School of Global Public Health is looking at new marijuana products. Particularly during the time of COVID, people have been using lots of recreational drugs. And there's lots of new forms of marijuana, be it edibles or vapes. We're looking at people's sexual effects, sexual risk behaviors, and use of marijuana products. And then in collaboration with the Dean of the School of Public Health, did a web survey looking at knowledge, attitudes, and beliefs of young adults about COVID. We're sort of analyzing the survey data, and they're working with some students in Tisch School of the Arts to develop a public health educational campaign for young adults about being safe with COVID. And again, in collaboration with our ethicists, we're looking at practices sharing qualitative data. So there's lots of research that shares quantitative data, but it's much harder to share today when you're talking to participants and you have written data. We're developing some software that anonymizes that data and allows it to be shared so that it could be used in other studies. And again, in collaboration with that same bioethicist, we're looking at the challenges of testing people who have kidney disease. There's a genetic risk factor, the APOL1 gene, that makes people with recent African ancestry to be at higher risk. And so we're doing a community engaged mixed method study to identify how we identify people who should be tested for this gene and what implications it should have on kidney donation processes for people who are getting kidney transplants. So I hope that gives you all a pretty good sense of the wide variety of projects that a biostatistician can work on, all different types of things that we can do, and maybe also gives you a sense that I get bored easily, so I like to work on lots of different things to keep me interested. Back to you, Rebecca.
Great, thank you. Okay, and next, Professor Xu Zhu.
I'm sorry. Okay, my question is what, sorry, I think I am supposed to see what are the possible paths to become a biostatistician. Okay, so as Dr. Batansky, Yan, and Dr. Goodman.
Wait, I'm sorry to interrupt you. So I think those are the questions coming later. Do you want to say a little bit about your own work?
Okay. So
it can be very briefly, and it's okay if you don't have a slide or anything.
So yes. During COVID-19, I prepared a course introducing SAS to people who are interested in data analysis. I think this will help people to connect their research interest and specific data. So we use the data from the Johns Hopkins Whitening School of Engineering, and it worked very well. People are very interested, and then so this is reflect a part of my my research interest. I'm very interested in applying different method to study specific questions in real research, and also I'm interested in providing some statistical tool in terms of software programming to general users. So more people have interest in content area, they could use the tool to answer their research question on their own. So specifically, I'm interested in longitudinal data analysis, missing data method, control for confoundings in observational data. And I have collaborations with experts in tobacco research, we look at data for public use, and we study the initiation, relapsing, and cessation of emerging and conventional tobacco product. For example, cigarette use or e-cigarette use, hookah, Juul. Those are very interesting topics. And also, as we know, there are also our public health issue we are facing on a daily basis. So in general, I feel it's a fascinating career for me as a biostatistician, through which I could link my interest in statistical modeling and application of those statistical tools to solve problems in real life. So yeah, this is a very interesting position to me.
Great, thank you. Okay, and Professor Haishu?
Let me show my screen. Can you see my screen?
Yes, yes.
Okay. Okay, let me first introduce my research interests. So my research mainly focuses on high-dimensional data analysis, machine learning, deep learning, medical image analysis, spatial temporal data analysis, and their applications to brain tumor, breast cancer, and Alzheimer's disease. And I will show you my research project that uses these statistical tools and methods. So the first project is about brain tumor and the connectome. So the connectome means the connections between brain regions. So we first segment the brain tumor in MRI image using deep learning models, and then study the tumor's impact on the brain connectivity. And then we use the fiber tracking technique to build up the brain connectivity network, and then use the functional data analysis to test whether the tumor has a significant impact on the brain connectivity. And here are some figures. And so the figures on the right show one patient's brain connectivity. And we use the fiber tracking technique to build up the brain connectivity network for this patient. And the circular graphs here shows the group level connectivity between brain regions. And you can see here, some regions have stronger connections in the disease group when compared with the control group. And some regions, however, has weaker connections in the disease group compared to the control group. Okay. And another research is about breast cancer. And for non-cancer subjects, we measure the breast density and the texture patterns based on the patient mammograms. And we want to predict the risk of these patients' probability to get the breast cancer. And then we use the deep learning and texture analysis to capture the density and the texture patterns on the patient's mammogram, and then use these features, put these features into a regression model to predict the risk for this person to get breast cancer. And for cancer patient, we combine the multiple genomic data sets, for example, the RNA expression data and the DNA methylation data, to discover new cancer subtypes. And these subtypes are related with the survival and the clinical outcomes. And we hope these new subtypes can help doctors to make better decisions. And in this project, you can see we use several different statistical tools and methods. For example, for the data integration methods, such as CCA, we use the data integration method to combine the information across these different multi-platform genomic data sets. And we also use the clustering method to discover the cancer subtypes. And then we use the survival analysis to predict the survivability of those patients over time. And then we build up a classification model to classify a new coming patient into our discovered new subtypes. Okay. And I also have an ongoing project for Alzheimer's disease. And Alzheimer's disease is a very common dementia of old age. And we want to discover Alzheimer-related brain regions with high accuracy. And we use traditionally people use multiple testing methods to detect significant different regions between disease group and control group, but they ignore the spatial information in the brain. So we use deep learning method to capture the spatial information in the brain, and then use such information into our multiple testing method to get a better testing performance. And here I can show you some result, preliminary result. And you can see this figure. And the HMRF list is our preliminary method that includes spatial information. And you can see we can discover more disease-related brain regions than the traditional BH method. And using this disease-related brain regions, we can use them as biomarkers for early detection of Alzheimer's disease. And these are 3 major projects I'm doing. Thank you.
Great, thank you. Okay, do you wanna, okay, great, excellent. So actually, Hai's discussion of Alzheimer's disease reminds me that I should announce to everyone that we have very good news for our department that may be relevant to many of you. So we just learned last week that we were awarded a grant from the NIH, the National Institutes of Health, to support a summer program that is called Pipelines into Quantitative Aging. I think that's what it's called, something like that. But the focus is aging-related research, such as Alzheimer's disease, and of course, biostatistics, data science, statistical computing, and epidemiology. So we will have a summer program starting next summer for undergraduates who are interested in public health. And please stay tuned and check out our website for more information on that. Okay, so now I would like to go to some questions that we received from many of you. So, Vardia did a really great job of sort of putting them into themes, and I organized them additionally. So I'm going to open up some of those questions, and then the panelists will take turns responding to them. So let me find where I have those. Okay, and now I need to go and share my screen. Okay, so here are some of the questions that were COVID-related questions. So we'll like I said, we'll take turns responding to these. So first question, oops, I need to just move out of the way here. There we go. Okay, sorry. Okay, how are biostatisticians collecting and or using publicly available COVID-19 data to conduct data analysis? So you've heard some of this in the course of our presentations, but Yang will address this additionally.
Sure. As you may see in a lot of websites, including New York Times and various resources, you see a lot of like visualizations, statistics reported every day. So actually there are many well-organized data repositories for COVID-19. A lot of them are available on GitHub with well-organized format. For example, there's the Johns Hopkins COVID-19 database, and they also have a very nice dashboard. And there's the COVID tracking project. I should also mention that NYC, New York City Department of Health has a very nice data, which I think is perhaps more complete than other places in the US. It includes also demographic stratification of the cases, and other statistics, for example, by different borough, by different zip codes, by age. So it's very detailed data. So all of this can be easily pulled from the GitHub or downloaded following the instructions. So besides the statistical modeling, like I described, and also Rebecca and Melody talked about, so in particular, I think I want to say that the clinical trials involved in treatment and also development of vaccines. How do you make sure that it's safe, and what is the plan of vaccines? For example, like maybe they will also go into different phases. So I'm sure that biostatisticians will play a very important role in all these different directions. Yeah. So I'll stop here.
And the next question, do you want to address that? How is big data involved in getting models that explains the spread of COVID-19?
Sure. So traditionally, for modeling the epidemic, there are like well-established models in, say, epidemiology, for example, the SRI model or various extensions for COVID-19. So as you can see that there is a surge of research interest, not only from the epidemiology, people also from all kinds of disciplines, because I guess it's perhaps the most studied epidemic ever, right? So there are, I think, over perhaps 40,000 articles already written on COVID-19. So the big data is very relevant because for COVID-19, the data is, there's a lot of different data types available. For example, as I mentioned, the social media data, and also say later we would have like a contact tracing data. And also this is a big data set. So there are already a lot of research on using machine learning or deep learning approaches. So which I think was shown to be even perform better than the traditional method. So it could be possible because more information are used in the modeling process.
Great, thank you.
Okay. Sure.
Okay, next question for Melody Goodman. Particularly in the public health field, how can statistics be used as an aid to interpret or determine racial disparities during COVID-19?
So I think statistics are really important, particularly when we think about samples and populations, but also about absolute differences compared to relative differences, and making sure that we understand fractions and rates. And so I think statisticians are involved in sort of all aspects of trying to figure out if racial disparities exist in COVID-19.
Great. And how to go about any research initiatives with the limited COVID guidelines?
So when COVID first hit, we stopped doing in-person human subjects research as a school, but most of our research was able to happen virtually. And so I think it made a lot of people a little bit more creative about how to set up their studies and how to work with participants if they weren't going to do face-to-face. And now that we are doing some face-to-face research, we are following all of the guidelines to make sure that both participants and research staff are safe. But I do think that people who are researching in public health are on the forefront of knowing about the new knowledge and the changes. And so I think a lot of us, as you can tell, are sort of working to make sure we have better understanding of the pandemic.
Great. And I guess I'll add to that, for those, many biostatisticians are conducting studies and have participants, but many biostatisticians are working with data and collaborators. And so being, stuck at home isn't so much of a limitation for doing a lot of biostatistical research. So that is one plus of being a biostatistician. Okay, let's go to the next page. Okay, so this next set of questions has to do with careers or career paths. So Violet, do you want to begin with this? What are possible paths to becoming a biostatistician?
Yes, so there are three main types of paths. I say main types, there are many different ways to eventually become a biostatistician. But mainly the common paths for biostatistician are academia, industry, or government. So which path to take, it depends on your own interest. For example, if your aim is to develop new theoretical statistical method, then that means you really need very rigid training in statistics. So you are supposed to obtain a theory-based doctorate from a theoretically inclined statistics or biostatistics department. So you really need that advanced degree, which allow you to do very advanced research or having a teaching position in academia. In other scenario, you may work in government or industry or in a clinical trial research environment. This doesn't require you to have a doctorate. And oftentimes, say people with a bachelor's degree or master degree, if they are not sure whether I want to pursue higher degree, but I know I'm interested in data-related work, then they may take those positions and they may work on different data-related work, then figure out what's my interest. Do I want to pursue a higher degree or am I satisfied? So those positions doesn't require a doctorate.
Okay, thank you. Okay, and I guess I would add to that, and I think we'll get to this in the next set of questions, that this Violet's answer applies as well to the question about paths to a master's degree program, for example. Students come from many, many different places to even to a master's degree program, and we'll talk about that more. Okay, so next question I'm going to give to Dennis, who, as you recall, just graduated from our program a year ago. So what are the career options for someone who has a biostatistics degree? Could you introduce the overview of employment of students after they complete the biostatistics program?
So in my personal experience, I think there are a lot of career options for someone who has a degree in biostatistics. Doing a simple job search, you'll just on whatever kind of search engine, you'll find a lot of, or just a variety of jobs and a variety of industries that need data-related skills. And what you learn in a biostatistics degree are, just these general methods of statistics that are used across several different fields and industries. Specifically though, when we talk about biostatistics and applied to public health and healthcare and medicine, a lot of the jobs are academic or in kind of industry settings like pharmaceutical companies or insurance companies, or also in nonprofit organizations that do a wide range of work. But in all of these settings, there's a lot of data and there's a need for summaries and analysis and predictive modeling. And so, yeah, I think anyone with a biostats degree will find that there's a lot of different opportunities.
Great. Okay, for Hai Shu, what are the opportunities in technology innovation in relation to public health and data science? And of course, I'm asking Hai because he does a lot of work in imaging, neuroimaging, and technology like that.
So can I share my screen to answer this question?
Sure.
Okay, so maybe Rebecca, you need to stop your sharing so I can share.
Oh, okay. Sorry about that. Yep.
Okay, let me share my screen. Okay, so can you see my screen?
Yes.
So this is a blog listed the trends and opportunities in technology innovation. And so we can see the top one is about artificial intelligence. Okay, so artificial intelligence is so-called as AI. But to me, AI is just a bunch of statistical models and computer algorithms. For example, the deep learning or deep neural network, the key technology of artificial intelligence can be considered as a nonlinear model in statistics. Okay, and for example, for Google AI team, they use the deep learning method for medical diagnosis, such as the early detection of diabetic eye disease and breast cancer diagnosis. Okay, and so for the artificial intelligence, our department also provides related courses, the machine learning and the inference. These courses cover related topics I mentioned in the artificial intelligence. And we also can see the top 5. The top 5 is about data analytics and visualization. Okay, so it's quite related with our field. And for example, for the Fitbit, so Fitbit is a smart watch, can track and analyze your daily life activities and also alert you to health issues. Okay, and so what underlying the functions of this, these functions of Fitbit are just statistical models and algorithms. And another example is the 23andMe. So a company sells DNA kits, okay? And based on your DNA information, they use statistical models and algorithms to let you know your genetic health risks and also show you your ancestry composition. So this is about data analytics and visualization. And also I want to mention the clinical trial design and analysis used in pharmaceutical companies. And for example, to design the clinical trials for COVID-19 vaccines, okay? And our department also provides the clinical trials courses for students. So these 3 parts, artificial intelligence and data analytics and visualization and the clinical trials, these 3 parts are quite important in our field. So I think these are opportunities and trends.
Great, thank you. Okay, let me go back to my questions. Okay, great. Okay, so here is a question from Melody. What are the dimensions of using biostatistics in developing countries and maybe not developing countries with deteriorated healthcare systems?
Yeah, so when I first saw this question, my response was the US has a deteriorated healthcare system. But I assume the person is asking about working as a biostatistician in places that are low resource. And so I would say to that a lot of people use software like R and Python, which are available for free in terms of statistical analysis. And you see people using things like Excel and Google Sheets for data management. And while some places may not have electronic health systems, the same is true here in the US. I will say that many universities, including NYU, have global sites in other countries. And so now for researchers that are here in the US, it's become pretty easy to collaborate with an academic at a global site who is on the ground in that country in order to do research there.
Great, thank you. Okay, Violet, what do collaborations with public health agencies or between public health agencies and biostatisticians look like?
Yeah, so biostatistician team is a very, very important component of public health agencies. So those agencies include national level organizations responsible for public health, infectious disease control, and epidemiology. Even said so, biostatistician may work directly with epidemiologists or expert in infectious disease, but may also working with people with other expertise within public health agencies, like law, education, cardio, or a specific type of disease. So basically, what does biostatistician do? We do consulting and collaboration, just in general. And by the way, our department has our student consulting club, which will help students to develop the skills in consulting, in statistical consulting. And in general, what do we do? Actually, biostatisticians may work in different phases of our project. So biostatisticians, depending on their background and expertise, they may consult or collaborating with other investigators on what are the technical advances we need for our specific type of research question, and they discuss and decide on study design, data structures, data collection, and data storage, and also more important, very importantly, data analysis, and also how to interpret the results so that they have a way to deliver the research outcome to government, to public health, to public population, so that they can highlight the impact of their research.
Great, thank you. So I didn't mention before, but this is a good opportunity to let you all know that Professor Goodman is also the Associate Dean for Research at the School of Global Public Health. So she knows a lot about funding for research. So she will answer the next question. How do biostatisticians benefit from funding mechanisms?
So I think biostatisticians are actually quite lucky because we can both lead our own studies, but we also collaborate a lot on other studies. And I think most people collaborate, but biostatisticians are often highly sought after collaborators because almost every project needs a biostatistician. And we can get funded from a variety of different sources depending on the type of problem that we're studying. So I think people get funded from the government, but there's also people that get funded through industry and other sort of private mechanisms like Google and the like in terms of machine learning, but also on a variety of projects where they're consultants working with other lead investigators.
Great, thank you. Okay, so let's see, I need to move this out of the way. Oops. Okay, so there were a bunch of questions that were practical and have to do with our degree programs. So we'll go through those. So first, what are the general requirements to apply to the biostatistics program? What are some things that would make an applicant more competitive? So the first answer that I always give to that is the personal statement is extremely important, and sometimes people overlook that. but it's really important for you as an applicant to make a really compelling case that you want a degree in biostatistics. You need to convince us that you really are interested in biostatistics, and that is almost, you know, certainly equally, if not more important than everything else that comes through on your application. Because if you have, you know, the passion for it and the motivation and the interest, that will get you most of the way to where you need to be. Now, of course, you need to have classes. You need to have taken, you know, you have to have an undergraduate degree. But we're very, you know, it's very broad, and our students are really heterogeneous in terms of their backgrounds. Some of them are coming from math or statistics or computer science, but many are coming from other fields, the sciences or social sciences. People are coming from all different places. And the reason for that is, you know, people's interest in public health and in biostatistics develops for different reasons and at different points along their prior education. So the actual requirements are, you need to submit, you need to apply through SOFAS, which is the sort of the common application for schools of public health. You need an undergraduate degree. We currently have a requirement for GREs, although not during this period of COVID-19, because we understand that taking the GRE, it can be difficult or impossible. So we've waived the GRE requirement for this year. And we always think about what to do with it in the future. But even so, even when it is a requirement, I want to make sure to convey that we don't have any thresholds. We don't throw away any applications on the basis of a GRE. We'll look at it, but it, you know, we don't, it's just, you know, one very small piece of information that's coming in with a lot more information. Letters of recommendation are important. You should make sure to get them from people who know you and can speak to you as maybe as a student, as a researcher, as a colleague. And then we look at your courses, and we don't have any specific requirements for courses that you should have taken, but it's easier to make a case that you want to be a biostatistician if you have had some exposure. So whether it's through classes or whether it's through work experiences, you should be able to demonstrate that you do know enough about it to really make you want to go through with that, to enter the program. Okay, next question. Commonly used statistical packages and methods that students should know. Melody?
So I think the commonly used statistical packages are SPSS, Stata, SAS, R, Python a bit. If you do GIS, people use ArcGIS. And one of my new favorites for data visualization is Tableau, which almost all of the COVID-19 dashboards are done in Tableau. And students always ask me which ones they should know. And so my response is, it's like any language, it depends on who you want to communicate with. So if you speak English, it means you want to talk to English speakers. If you speak Spanish, it means you want to talk to Spanish speakers. So the same is true with the software programs. They all pretty much do the same thing. It's just a matter of who you want to communicate with. And in terms of methods, I always think that students should be exposed to a broad array of biostatistical methods in their training to figure out what they really are interested in. But I think you've heard a lot about clinical trials. I think one of the methods that you haven't heard a lot about today are regression-based approaches, and a lot of my research uses those types of models, a wide variety of different types of regression models.
Great, thank you. Okay, how relevant can a degree in applied math be in biostatistics? Yang?
Yeah, yeah, this is a very good question. So just as you know, I got my degree in mathematics in undergraduate. So applied mathematics is not far away from mathematics in undergraduate, at least. So this, it may appears to be quite far from biostatistics. However, I think the training in applied mathematics, applied math, could be actually very useful in statistics or biostatistics. For example, usually for starters, the mathematical statistics, usually it's a required course in applied math degree, which is actually the foundation of biostatistics. Also, there's usually the course on optimization, which if you have done any modeling, you will know that optimization is becoming more important to be an important component of a successful modeling process. So there are also other courses in applied math, for example, ordinary differential equations or partial differential equations. These could actually be very useful in building academic models. Actually, the classical epidemic models are actually solved by differential equation techniques. So I think it's definitely very relevant, and I would say you. So this is I think if you study like mathematics, it's your way forward is pretty broad. I think biostatistics definitely one possibility. Yeah.
Great, thank you.
Sure.
Okay, for students who do not have a solid math background, what would you suggest them to do to apply to a master's in biostatistics? So that's a good question. And one really, in my view, nice feature about the field of biostatistics and statistics is that it's very, very broad. You can be an extremely theoretical biostatistician or statistician, and you can be essentially no different from a pure mathematician and study probability theory and prove theorems. On the other end, you can be extremely applied and do very, very meaningful work in the context of applications. And so there's really room within the field of biostatistics and statistics for a whole range of different levels of math background. And so, for example, in our program, we don't require calculus. So you can go through our courses and learn a lot of biostatistics and not know calculus, and that is fine. On the other hand, if you have that, then there are other courses you can take, perhaps higher level statistical inference or higher level probability that would build upon that. So, so I guess the answer is you can fit in with any math background. Now, that being said, if you have years of undergraduate ahead of you and you want to prepare yourself, I would recommend taking a course in probability just to get you in the mindset of statistics. It's a slightly different way of thinking from the way we normally think or the way the world thinks, perhaps. And so it's a good introduction, and if you like it, then that's great. And so it's good to get that, I think, as background, and then perhaps a course in statistical inference. And if you're really interested and you really do like math, then certainly be sure to take calculus and even perhaps linear algebra, which could prepare you for higher level statistics or biostatistics courses. Okay, and last question that we have here. How can you learn or be introduced to biostatistics in undergrad if your school doesn't offer the course? That's an excellent question. So many schools do offer statistics courses. They may not offer biostatistics, but probably most schools offer statistics. Now, you have to be a little bit creative when you go and look for them, because you may be in a school that doesn't have a school of public health, or you may be in a school that doesn't have a medical school. And in that case, a statistics course might be found in a math department. It might be found in social sciences. So it might be in a psychology department. Let's see, where else might you find it? Sometimes in neuroscience, there is a statistics course. So I would be extremely surprised to find any school that didn't have any intro statistics course somewhere. The challenge might be finding where it is. So I guess my first answer is look hard, ask around, and hopefully you'll find it, because hopefully it's really there. And if it's really not there, then there are many online free courses that you could take that are very good intro biostat courses, maybe through edX or Coursera. So there are many, many possibilities in that way as well. Okay, so I think that ends our prepared questions. Let's see what time it is. We have a few minutes. We had planned to go till 10. It's late for some of us. Let me open up the Q&A. Well, let me stop sharing my screen and open up the Q&A. So I think at the, one question that I saw early on had to do with the courses that we offer and whether someone could still sign up for them. And I have two answers to that. So one is it's not too late. And if you email me or Vardia, we can connect you with the right way to sign up for them. And Melody, maybe you want to talk about, your course hasn't happened yet, has it?
It starts on Monday. Monday,
okay.
Friday next week, we're running a course called Through the COVID Magnifying Glass, an examination of racial and ethnic disparities.
And the nice, very nice feature of that class is that that's free. So that's open to the public. So we can give you information about that as well. But there is, to answer another question here, other than that course, these are credit-bearing courses, and so there is a cost for them. Okay, I don't know if any of you, so please, to my fellow panelists, feel free to look through the Q&A and see if there's anything here that you want to address.
So there is a question about how exactly do you get human behavior data from Twitter and Facebook? Yeah, this is a good question. So I think for Twitter, maybe it's easier than Facebook because technically most Twitter tweets are publicly available. So if you are familiar with Python, for example, you can actually write a script to get certain, for example, hashtags you are interested in to extract the count. And also, I think you can also get location information if the user provide it. If you're authorized to report a location, so you can also get the location of the tweets. Right. I think that's the way. Also, there are, of course, companies or services you can use to get the data. You can help you to get the data. If you want to pay some money, they can do it for you, I think. Right.
Great, thank you. Okay, so there were a lot of questions about the courses. So yeah, so please just follow up with us. And I see that Melody posted the link for her course.
Right, so my course starts next Monday. So if you're interested, you need to take action now.
Great.
I think.
Okay.
Right. So it's just
good. Okay, I see one. I think we're going to end with one last question that I see here, which is a good question to end with. So before I launch into the question, I'll just say thank you to everyone. Thank you to the panelists. Thank you to Vardia, to Chris. Thank you to all the participants. And we really hope to hear a lot more from you and answer your questions as you move forward. So this last question, what is the favorite thing about your job? So I'll start. So I think one of my favorite things about being a statistician is that that I have a set of skills, I have an area of expertise, and I can get involved with many, many different kinds of applications. And over my career, I really have done that. Most of them are within medicine. So I've done work in brain tumors and Alzheimer's disease in many, many different areas, all at the same time developing new statistical methods and applying them in those contexts. So it's very, very fun to me to learn about different areas of application and to be able to pretty quickly move in and make some kind of a contribution there. Anybody else?
As a new recent professional statistician, I would say that I really enjoy generally that statistics and being a statistician is also kind of applying the science of research as well. And you're constantly, you know, assessing the quality of the methods that you're undertaking to make certain conclusions, and so you're basically trying to help make the most accurate conclusions, and that's a great feature for anybody interested in critical thinking and analytics.
Okay.
I like about my job the most is that no two problems are exactly the same. Even when you think going in, you know how to solve something, there's usually some unique or interesting thing that you have to fix. And so for someone like me who likes to solve problems, I think that makes the job really interesting.
Great, thank you. Violet?
Yes,
Hi.
I like my position very well. I feel the best thing is the flexibility in terms of a lot of ways. So in terms of the thing I'm working on, I can select the topic of research I'm interested in. Statistics method is kind of like a tool. We can apply the tool to many different topics. That's one way I see the flexibility. And also in terms of who you want to collaborate with, another flexibility, and the location, as long as we have a computer, the computer is connected to internet. Regardless, you work in daytime, at night, in a coffee shop, or in a bathroom, doesn't matter, you can still work. So I feel my work is not impacted that much by COVID-19 because I still have grants submitted, I still have manuscripts submitted, I can still run analysis and teach. So I really enjoy the flexibility of being a biostatistician.
Anybody else? Okay, well, it's 10 o'clock and I think it's time to say goodnight. So thank you all and hope to hear from you soon. Take care, everyone.
Take care, everyone.
Thank you.
Bye.
Thank you.
Bye.
Bye.
Thank
Yeah,
you.
bye.